Does your spine and core need stability or does it need support? I'm Stephanie Carter Kelly, a physical therapist that uses yoga in everything that I do. And so, for almost my entire career, I used the term stability when I was talking about the spine and how the muscles would help decrease low back pain. But I changed my thought over the years. I don't like talking about stability anymore. I like talking more about support. Because when I understand the function of the muscles that really help keep low back pain away or help get you out of low back pain, I like thinking about a little bit less. So let me just talk about it a little bit. When I think of stability, I think of rigidity. I think of something that is not flexible, it doesn't move, and that's not what your spine needs. Your spine was meant to move. And so I think of support as a much lower level amount of muscular activity that supports the spine but also allows it to be flexible. The other thing I tend to think about when I think about stability is something that you need to put on externally, or something. I think of a spine fusion, that stability that's necessary because something is dangerously unstable. And so we put that fear into our clients and our patients, and maybe you have felt that fear when somebody says that you're unstable, that your SI joint is unstable or your lumbar spine is unstable. And so just using that word stability sounds like that we need to impose something upon that spine to make sure that it stays stable. So I like to instead think of support. You need a little help. Your spine needs help in being able to move correctly and be fluid in its movements. It's something that comes from the internal, those deep muscles that can help just hug and support. They're asking for help. And so stability is imposed, whereas support is desired. And so I put both the body and the mind because I think that the mind has a lot of control down to that area of the low back pain. So if the mind is scared of what's going on and thinks it's unstable, then it's going to keep you in pain. But if the mind is sending positive messages, it's feeling that support, it's giving that support to the spine and thinking that, yes, I can overcome this. Yes, I can be resilient. I can get over this pain because I know that I can figure it out and I can work towards supporting myself muscularly, mentally, and have a much better outcome. So what this results in is a lot less work. I always say you need a lot less for the core. You don't need more. You don't need more exercise, more intensity. You actually need less exercise, exercise that is coordinated with your breath, because the breath helps to support that area of the back also. So it's really about less is more when it comes to training the core. And so if you're interested in how to do less but have a better outcome in training the core musculature and also to train your mind to support you, I'm offering an online workshop October 18th, 1 p.m. Eastern Standard Time. Even if you can't join me live, you'll get all of the information. This workshop has been living in my list of courses for a long time, and a lot of people have found it to be very helpful in order to do less, in order to train the core and have a better outcome. So it's really about assessing, do the deep muscles contract, Are the superficial muscles helping or hurting and actually increasing pain? And do you have the flexibility of the spine? So on that Sunday afternoon, I'm going to be leading you through an assessment so that you will know by the end exactly what you need in order to train your core. And you'll get all of the short videos that will lead you through the process. So I hope that you take the time to join me. I hope that you let go of stability and that you embrace, hug, support your core. I'm Stephanie Carter Kelly, a physical therapist that uses yoga in everything that I do. Namaste.